So the news just broke that Khloe Kardashian had a skin cancer scare on her famous face, and it required immediate surgery. And I, as the budget dermatologist, have a lot of thoughts. Hey, make sure you're subscribed to my YouTube channel for more skincare made simple advice, and follow me on Instagram at the budget dermatologist. So Khloe Kardashian decided to break her silence after being questioned for weeks because of this bandage that she has been wearing on her face, specifically her cheek. I saw this story right before I went to bed a couple nights ago, and I haven't stopped thinking about it, so I decided to hop on here and give you guys my quick initial thoughts on this news. And as a disclaimer, I do not know any of the doctors on her team that were involved with her care. I only know the info that is in the media that you also have access to. So here's what happened. Per Khloe Kardashian's Instagram story, Khloe noticed a small bump on her cheek about 7 months ago. She states that it looked like a pimple or a zit and didn't even worry about it. Here's my first thought. I totally understand this. As someone who is about Khloe Kardashian's similar age, it's normal to get these new bumps on the skin that come and go. Acne bumps are still really common, even for people in their 30s and beyond. But the key here is that they should come and go. And if it does not go, it may be a skin cancer. So Khloe Kardashian did the right thing by getting this examined by a professional. Okay, so she goes on to then say she visited a board-certified dermatologist to evaluate this spot. I do not personally know this dermatologist, but it does appear that she has the proper credentials to actually call herself a dermatologist. So my next thought is, great job for seeing an actual dermatologist, a real skin expert. And I want you to know that many people can call themselves dermatologists, but this can be misleading to you and the public at large if that person does not have the proper training. So check their credentials of the person you are seeing. So Khloe Kardashian definitely did her homework here, and that is a great message to send. So I'm loving that. Next, Khloe said that her dermatologist was very concerned about this spot. Now, here's where the story gets a little confusing, and I'm dying to have all of the details as this nerdy dermatologist that I am, but we didn't really get the juicy details yet, and we may never, and that's okay too. So Khloe only mentions that she gets a second biopsy. I keep doing air quotes, but I'm literally telling you what she said. So I'm not sure what happened with this first biopsy, but she went to a different dermatologist at this point for a procedure, maybe a second opinion, I'm guessing, because something that they were seeing was apparently, as Khloe says, very rare. So what does this mean? Let me explain what happens when you have a bump and you go see the dermatologist to find out what it is or if it's skin cancer. So the dermatologist will examine it on your skin. They will either say, that's benign, that's nothing to worry about, leave it alone. And they are doing that based on their expertise to make this judgment. Or they will say, this looks like it could be skin cancer. So to be sure, we need to do a skin biopsy to get a definitive diagnosis. Now, of course, I'm simplifying this a bit. There is a gray zone between these two scenarios, but basically this is the gist. So a skin biopsy procedure is usually done on the same day at that same appointment. It's quick, it's a simple procedure, but it can be quite stress-inducing for the patient and it can leave a scar. So for the skin biopsy, we numb up the area on the skin with a needle and a numbing medication, usually lidocaine. It goes numb within seconds, so it's super quick, but it can sting or burn a little bit when it's injected, and that's really the worst part of it for the patient. After that, you don't feel anything. So then we take a blade and remove a piece of this lesion and send it to the lab. So at the lab, there is another type of doctor called a pathologist, or in the case of skin biopsy, it's a subspecialist called a dermatopathologist, and they will look at this under the microscope for cancer cells. Now, they are usually able to tell us for sure if this is benign or malignant. So benign meaning that it's not cancer, and malignant meaning that it is skin cancer. And they can usually tell us the type of skin cancer it is, such as basal cell carcinoma or squamous cell carcinoma or melanoma or even other more rare forms. So back to the Khloe Kardashian saga. she gets the results back and she tells us she has an incredibly rare tumor that needs immediate operation. So my thought is that sounds very scary, kind of like an actual skin cancer. And I thought it was an interesting choice of words to only refer to this as a tumor because it automatically makes us think or assume that she has skin cancer because tumors sound scary. But here's the thing. You can have benign tumors or malignant tumors. Tumor is just a word for a growth, basically, and not all tumors are cancer. So that makes me think that Khloe might not have had an actual skin cancer form of tumor, but I'm not sure. And even her doctors who posted about this on social media and her mom, Kris Jenner, who also posted about it, were all very careful to use the same word tumor. There is actually no mention by them or anyone on her team about skin cancer, just that it was a rare tumor. Now, I'm still dying to know what type of tumor was it, or what was the actual diagnosis that required immediate surgery if it wasn't actual skin cancer. Well, to me, that could mean a lot of things, and we may never know depending on how much she wants to share. It's also not our right to know. It's just interesting for me since skin and skincare is my whole life and it's my career. It's just interesting to think about these things. So I respect her decision for wanting to be as private or public about her own body and health as she wishes, but I do love the awareness that this story is bringing to skin cancer. Okay, so next she says she has to go to a plastic surgeon to get this immediate surgery. So here's my thought, and something that you should understand. If you have a skin cancer or a tumor, there are certain dermatologists that are the absolute experts at surgically treating the skin cancer and reconstructing the skin afterwards to give you the best cosmetic result with the smallest scar. So Khloe Kardashian didn't have to go see a plastic surgeon for this, and this does not necessarily guarantee that she will have a better cosmetic outcome. And many people do not understand this. In fact, there is a lot of overlap in what a dermatologic surgeon and a plastic surgeon are trained to do for skin surgery. So during dermatology training, we undergo extensive training in skin surgery and functional and cosmetic repair of the skin. And some dermatologists, like myself, go on after residency to do even more training in the subspecialty area of skin cancer and surgical reconstruction of the skin. This is called a micrographic dermatologic surgery fellowship, and then we take another board exam to become board certified skin cancer surgeons. This is what I did, and that is really the main focus of my dermatology private practice. I diagnose and surgically treat skin cancer and tumors of the skin. So if you have skin cancer, especially on the head and neck, make sure you understand the skill level of the doctor that is treating your condition. Oftentimes, this is a dermatologic surgeon. So to finish this saga, Khloe Kardashian had a surgery done on her skin by a plastic surgeon. Presumably, the plastic surgeon cut out this entire tumor, however big or small it was, and then used stitches to sew the skin back together. She even said that the margins were clear, which means that the entire tumor was removed, and this was likely verified by a dermatopathologist. You see, what happens when a tumor is removed from the skin is it's then sent to the lab just like the biopsy, and the dermatopathologist again looks at it under the microscope to see if the entire tumor was removed. If the surgeon got it all out, the dermatopathologist will say margins are clear. That means that you are done with the surgery. If they say margins are positive, that means you still likely have tumor on your skin and need further treatment. So this was great news for Khloe Kardashian. Her tumor was fully removed with clear margins. So then what happens is she is now going to let that wound heal and is now in the scar healing phase. So when stitches are used, if they are not dissolvable, they will typically be left in the skin on the face for about a week, then they are removed. The good news for Khloe Kardashian is that the skin on the face tends to heal very well, and scars can often be barely noticeable over time, but it is a long healing process. A new scar is going to look red and raised, And then gradually over time, this starts to settle, flatten, and really fade to be closer to your natural skin color. There are a few things that you can do to help your scars heal better and to improve the cosmetic outcome. First, follow the wound care directions from your surgeon very precisely. That usually means you should keep it covered with a plain ointment over the sutures or the stitches, like Vaseline or Aquaphor or even Vanicream ointment, and then a bandage on top of that while the stitches are in place. Again, follow the directions of your surgeon. Everybody has a little bit of a different take on it that they prefer, but this is my general advice that I tell my own post-operative patients. Next, to improve the outcome of the scar, avoid tension on the scar as much as possible. The more tension you place on the scar, like pulling or stretching motion, the wider that scar will be and the more difficult of a time you will have healing it. And you can even burst open the sutures if you put enough pressure on this wound. Typically, this isn't as high risk on the face, but if you have surgery on the arm or the leg or the trunk, like your chest or your back, it's actually much easier to pull the stitches apart, so take it easy after surgery. And did you know that you can use something called silicone gel sheets over your scar to help improve the cosmetic healing? This is a big one that patients always ask about, so I'm going to link some options below that you can purchase and put on your scar while it's healing. Again, ask your surgeon first before you start doing this. Silicone has been shown in studies to improve the cosmetic appearance of scars, so if you want to put something on the scar to help it look better over time, use silicone gel sheets. Again, I'm linking some below. Do not use Mederma and other random oils and other things marketed as scar treatments. Literally keep it simple. Stick with these. Literally stick with these. These stick to your skin and they help. So I'm happy for Khloe Kardashian that she is cured and on her healing journey from this skin cancer scare. I love the awareness that this is bringing to the subject. It takes a lot of courage to share somebody's health journey like this, so we really appreciate it. So let this be your reminder to get your skin checked. And if you see something on your skin that just doesn't seem quite right or isn't healing, don't wait, get it evaluated. See you guys soon.